Picture this everyday scene. You wake up one morning feeling that all too familiar, uncomfortable heaviness deep in your lower abdomen. You head straight to the bathroom, sit down, and you wait. You wait for several minutes, but absolutely nothing happens. You try to strain just a little bit harder, but there is still no result. You think to yourself, maybe I just need to brew another warm cup of coffee to get things moving. So, you get up, go about your morning, and try again an hour later. It brings the exact same frustrating result. By your third or fourth attempt, something inside your pelvic region has fundamentally shifted, and not in a good way. Now, there is real, localized discomfort, a deep, dull, almost throbbing ache that begins to radiate from your lower back all the way down into your pelvic floor. You begin to feel uncomfortably full, intensely bloated, and a quiet little voice in the back of your mind starts whispering, something is seriously wrong here. If that sequence sounds familiar, if you are watching this right now and that scenario hits a little too close to home, I urge you to stop whatever else you are doing and pay very close attention to this discussion. What we are breaking down today could genuinely protect you or an aging loved one from a dangerous, hidden medical emergency that develops right inside the home. Today, we are having the exact conversation that nobody wants to share at a dinner table, but that millions of mature adults, especially individuals over the age of 60, desperately need to hear. Our topic is a structural issue where waste becomes physically stuck inside the rectal vault. What are the silent warning signs your body sends long before the situation becomes critical? And most importantly, what practical, safe steps can you take right now to resolve it from the comfort of your home? By the time our discussion is complete, you're going to understand your own lower digestive architecture with absolute clarity. That practical knowledge is going to be the most important asset you carry out of this conversation. Take a slow, deep breath. Get comfortable and let us examine the hard data. Before we look at our step-by-step protocol, let us build our community connection. Please drop a brief comment below, letting me know your name and which city or country you are tuning in from today. I read through our community responses personally, and seeing who is part of our growing global family helps me keep these deep dives focused on your real-world vitality. Let us start not with a temporary fix, but by looking directly at the underlying mechanics, because this is where most standard health advice gets things completely wrong. People frequently treat mature digestive slowdowns like a simple dripping faucet. They ignore it for a week, stick a temporary bucket under it, and hope for the best. But what occurs inside a mature framework is not a minor leak. It is a structural pipeline that has completely seized up, and understanding the physics of why it happened is the absolute key to fixing it tonight and ensuring it never returns to disrupt your life. The baseline process involves your large intestine, that 5-foot-long muscular tube winding through your abdominal cavity. Your colon has one primary, highly efficient job: to extract and absorb water from whatever waste passes through its corridors. The dilemma is that when waste sits inside the lower colon for too long without moving forward, your body does not possess an automatic sensor to stop extracting that moisture. It continuously pulls water out hour after hour, day after day. What began as soft, manageable waste gradually transforms into a dense, dehydrated mass that holds the texture and consistency of hardened clay. This situation almost never develops overnight. It is not a sudden light switch that flips from perfectly fine to an emergency in an hour. Especially in older adults, it is a slow, gradual progression that builds silently over 3, 4, or sometimes 7 consecutive days. During most of that window, you might feel only mildly uncomfortable, slightly full, or uncharacteristically sluggish. You might even still be visiting the bathroom daily, but each time you go, you are only passing a small fraction of what your system needs to eliminate. A little bit gets out, but a massive portion stays behind, hardening further. Think of it like trying to push a large, rough, unyielding stone through a flexible garden hose. That stone is not going to slide smoothly. it will not compress, and the harder you mechanically push against it, the more firmly it wedges into the sides of the hose. That is literally the mechanical situation unfolding inside your lower tract. The harder you strain and bear down on the toilet, the more you are actually compressing that dense mass into a solid wedge rather than dislodging it. Why are we so vulnerable to this specific storm as the decades advance? After the milestone of age 60, several distinct physiological shifts occur simultaneously. First, your intestinal muscle contractions, the natural involuntary waves known as peristalsis, naturally slow down. Second, pain perception and sensory nerves inside the gut become less reliable, meaning you may no longer feel the early, soft urgency signals as clearly as you did in your youth. Third, a vast majority of seniors are on routine daily medications, such as specific blood pressure pills, nerve comfort formulas, iron supplements, or high-dose calcium that significantly slow down natural motility as an unintended side effect. Finally, our natural internal thirst reflex naturally weakens with age, leading to a state of chronic, low-grade dehydration that your body does not even register as thirst anymore. This is not a personal failure of your body, and it is absolutely not your fault. It is a perfect storm of biological updates that standard wellness segments completely fail to warn you about, and we are going to look at the exact signs that reveal this storm is brewing. We must look closely at how a localized blockage displays itself, because the warning signs inside a mature system can be deeply misleading. Getting these signs wrong frequently leads individuals to take exactly the wrong action, which can make the underlying structural strain dramatically worse. The first confusing indicator is the sudden appearance of watery, liquid discharge. I need you to listen to this mechanism carefully, because this is the exact sign that sends the most adults down the wrong path. You might be sitting at home thinking, I cannot possibly have a blockage because I am experiencing loose, watery stools. But here is the shocking anatomical truth. When a solid, rock-hard mass completely blocks the rectal passage, the newer, liquid waste coming down from higher up in the colon has absolutely nowhere to go. It performs the only maneuver it can. It slowly seeps around the outer edges of that solid obstruction and leaks out as a watery fluid. This is known as overflow or paradoxical leakage, and it consistently tricks mature adults into assuming they are managing a temporary stomach bug or a digestive infection rather than a physical blockage. The immense danger here is that individuals immediately reach for over-the-counter anti-diarrheal medications. Those formulas, designed to freeze all intestinal movement, are the absolute worst thing you can introduce to your system during a blockage. They do not clear the issue. They completely paralyze your digestive transit, allowing the stuck mass to continue hardening and expanding unopposed. If you experience watery leakage alongside a heavy, persistent aching feeling of rectal fullness, do not touch standard anti-diarrheal formulas. The second misleading sign involves your bladder wall. You may suddenly find yourself struggling to pass urine normally. You feel a distinct urge to go. You visit the bathroom, but only a painful trickle emerges. Or you find yourself needing to urinate every few minutes, yet producing barely anything at all. This is not a coincidence. Your rectum and your bladder are close anatomical neighbors that share a highly confined pelvic space. When the rectal vault becomes distended and swollen with a hardened mass, it physically presses against the bladder wall from behind, partially compressing the urethra and making normal fluid clearance difficult or even impossible. In severe instances, this secondary urinary retention can quickly become a significant issue in its own right. The third symptom that is consistently overlooked is deep lower back discomfort. This presents as a nonspecific, radiating ache in the lumbar region that does not seem connected to your digestion at all. Many adults naturally assume they simply pulled a muscle while gardening, or that their standard spinal irritation is flaring up due to the weather. But when internal rectal pressure builds past a certain threshold, the localized nerves send radiating signals outward into your lower back, down into your thighs, and straight into your hips, If you are experiencing an unexplained wave of lower back pressure alongside a shift in your bathroom habits, that combination is a distinct red flag worth taking seriously. Our fourth misleading indicator, and one that is uniquely relevant for mature adults over 70, is a sudden change in mental clarity or brief confusion. This sounds completely far-fetched to many families, but there is substantial clinical evidence demonstrating that significant lower bowel obstructions can contribute directly to what appears to be a cognitive episode. An older adult may display sudden disorientation, mild confusion, or unusual agitation. This occurs due to the immense systemic physical stress and autonomic discomfort the body is under, combined with early internal waste stagnation. If an aging loved one appears suddenly off mentally without an obvious cause, you must always evaluate their digestive status as a major contributing factor. If this is the first time you are hearing the genuine science behind your body's internal warning systems, please hit the subscribe button right now. We deliver clear, honest, senior-specific health insights every single week, and what we are breaking down next is something you absolutely need to hear. Let us speak with absolute straightforwardness because you deserve the unvarnished truth delivered with clarity, not wrapped in gentle language that softens a serious message. A physical blockage inside the rectal vault is a genuine structural emergency that requires deliberate action. It is not a minor nuisance, and it is not something you should simply sit back and wait out for another week. If left unaddressed, the internal consequences escalate in a highly predictable, serious sequence. In Stage 1, the intestinal wall, which is composed of living, flexible muscle tissue, becomes severely stretched far beyond its natural functional capacity. As the tissue stretches thinner and thinner, the localized blood supply to that specific section of the bowel begins to diminish. The muscular wall begins to lose its organic capacity to contract and push waste forward. Essentially, that entire section of the lower bowel goes quiet and enters a state of temporary paralysis. In Stage 2, as the physical pressure continues to rise, the swelling spreads upward, impacting higher sections of the colon. What began as a localized blockage inside the rectum evolves into a broader colonic obstruction. At this point, waves of nausea and vomiting begin to develop. Abdominal distension becomes visibly noticeable, and the individual looks and feels genuinely ill as the system struggles to cope. Stage 3 involves structural compromise of the bowel wall itself. Your intestinal lining has strict physical limits to how far it can stretch. When those limits are exceeded by a dense, unyielding mass, the wall can tear or perforate. The moment that occurs, the contents of the bowel spill directly into the sterile abdominal cavity, leading to a rapidly progressing, high-level infection that requires immediate emergency surgical intervention to preserve life. I am absolutely not sharing this sequence to cause panic or fear. I am sharing it because the stakes of ignoring a prolonged blockage are deeply real, and you have every right to understand the timeline clearly. The window between a situation that is serious but entirely manageable at home and an emergency that requires a hospital visit depends entirely on your awareness. What does the true danger zone look like from the outside? Here are the absolute signals that mean you must bypass home remedies and seek immediate emergency care without delay. An abdomen that feels rigid and board-like to the touch, a sudden high fever, constant and worsening abdominal pain that does not come and go as simple cramps, a complete inability to pass gas at all, ongoing vomiting, or a sudden drop in blood pressure accompanied by cold, clammy skin. These are not wait-and-see symptoms. These are indicators that mean you must head to a facility immediately. But if you are not experiencing those emergency indicators, how do we safely resolve this issue from home starting tonight? Let us shift our focus directly into our actionable response protocol. The very first action you must take, and I cannot state this with enough emphasis, is to stop straining immediately. Put the brakes on all physical forcing. Every single time you bear down with a solid mass blocking the exit, you are actively increasing your internal pressure, irritating already inflamed tissues, and risking painful structural tears. Straining will not dislodge a hardened impaction. Not once in human history has white-knuckling it on the toilet resolved a dense blockage. So, let us put an end to that mistake right now and look at our first targeted step. Step number 1 is strategic lubrication and softening using adult glycerin suppositories. This foundational home intervention utilizes options that are easily available over the counter at any local pharmacy without a prescription. But here is the crucial piece of clinical data that most standard instructions completely fail to share. For a significant hardened blockage in a mature adult, a single suppository is rarely sufficient to produce results. The standard clinical protocol for breaking apart a dense rectal obstruction involves introducing 2 to 3 adult suppositories simultaneously. A single unit simply cannot generate a large enough volume of active lubricant to coat, penetrate, and soften a large, deeply dehydrated mass. Here is exactly how to execute this first step correctly at home. First, do not attempt to do this while standing up or sitting down. Lie down comfortably on your left side. This specific posture, known as the left lateral decubitus position, aligns your sigmoid colon and rectum in a precise anatomical line that allows gravity to assist the entry rather than working against your body's pathways. Resting on your left side also removes all direct structural pressure from your pelvic floor. Next, apply a generous coating of a water-based lubricant directly to each suppository before insertion. Do not skip this detail. The delicate tissues inside your rectal vault are already uncomfortably dry and inflamed, and any extra dryness at this stage makes the process unnecessarily painful. Gently but firmly insert all 3 suppositories as deeply as possible into the passage. You want them pressed directly up against or alongside the hardened mass itself, not sitting near the opening where they will simply slide out before doing their work. Once insertion is complete, you must follow the most important instruction of the entire protocol. Lie completely still. You must hold that left-sided position for a minimum of 30 minutes, and ideally for 45 full minutes. The glycerin strictly requires that window of time to melt at your natural body temperature, disperse evenly, and slowly penetrate the outer shell of the hardened mass. It also requires time to signal the surrounding tissue to increase its own natural secretions. If you jump up and run to the toilet after just 5 or 10 minutes because you feel an initial wave of pressure, you will accomplish absolutely nothing except wasting the suppositories. After the 45-minute window has passed, rise slowly from your bed, head to the bathroom, and allow your body to eliminate the waste naturally without forcing or straining. If there is immediate movement, that is wonderful. If there is no movement yet, stay completely calm and do not become aggressive with your body. Step number 2 is to rest, walk, and repeat. If your very first round produces no results, grant your body a full hour of recovery. Stand up, walk gently around your living space, and drink a large glass of warm water. Internal warmth helps relax the surrounding intestinal muscles, easing tension. After an hour of gentle movement, lie back down on your left side and repeat the exact same multi-suppository process a second time. A second round is frequently what finally breaks through the core of the issue. The first application softens the dense outer shell of the blockage, while the second round successfully reaches the center to trigger a release. Step number 3. If home measures fail, it is time to seek professional evaluation. I want to be entirely unambiguous about this threshold. If you have completed 2 full rounds of our left-sided suppository protocol, waited the appropriate amount of time, and there is still 0 physical movement, it is time to head to an urgent care or emergency room. This is not a personal defeat. It is the correct, wise clinical decision. At a medical facility, the care team has immediate access to professional-grade solutions that utilize larger fluid volumes delivered under controlled pressure to break apart the mass safely from above. They also possess diagnostic imaging tools, such as a quick abdominal scan, to verify exactly how far the blockage extends and ensure the structural integrity of your bowel wall is perfectly protected. In rare instances where all other methods fail, a specialist will perform step number 4, manual clearance. I want to be entirely transparent with you about this procedure, because knowing exactly what to expect removes the fear and anxiety surrounding it. The physician will physically break up and remove the stuck mass using gloved, highly lubricated fingers. If the surrounding tissues are uncomfortably inflamed, this is not performed while you are fully awake in a cold exam room. You will be granted a gentle sedation or light anesthesia to eliminate all discomfort and allow your pelvic floor muscles to fully relax. It is a straightforward, safe, and well-established clinical intervention, and the immediate drop in pressure and pain that follows is described by patients as a wave of profound relief. Clearing the current blockage is an absolute necessity, but I would be doing your long-term health an immense disservice if I stopped there. If we do not immediately address the underlying conditions that created this perfect storm in the first place, you will find yourself right back in this position within a matter of weeks, and after the second episode, the third arrives even faster. This is how a temporary issue transforms into a chronic, repeating cycle. Let us look at how to genuinely protect your digestive health for the long term, especially if you are over 60 when the biological shifts are actively working against your motility. Rule number 1. Daily hydration is not an optional suggestion. It is the baseline foundation of all digestive health. Water is the single most important variable in preventing waste from hardening. Because your colon's primary task is to extract water, if you are not consistently providing your body with a beautiful abundance of incoming fluids, your colon will steal that moisture straight from your waste stream. The major hurdle for mature adults is that your internal thirst sensors genuinely diminish with age. You can feel completely fine, experience zero sense of thirst, and still be chronically dehydrated at a cellular level. Do not wait until you feel thirsty. Make a daily habit of drinking 6 to 8 glasses of pure water, including a large glass first thing every morning before you touch food or coffee. That morning, fluid on an empty stomach activates the gastrocolic reflex, a gentle, automatic wave of muscular contractions that encourages a natural morning movement without the use of a single medication. Rule number 2. Physical movement matters enormously. Your intestine is not a passive, hollow tube. It is active, muscular tissue that requires physical stimulation to maintain its rhythmic, wave-like movements. Physical movement of your outer body directly activates internal peristalsis, including a simple 20 to 30-minute walk immediately after your meals. Even an easy, comfortable stroll around the block has been clinically demonstrated to significantly accelerate your internal transit speed. For mature adults managing mobility limits or joint pain, even simple chair exercises, gentle torso rotations, or light yoga stretches can keep your abdominal muscles active. Prolonged sitting, especially during the hours immediately following a meal, stands as one of the most underestimated contributors to senior sluggishness. Rule number 3. Thoroughly review your medication list with your doctor. This step is entirely non-negotiable. A massive variety of everyday prescriptions, including common blood pressure blockers, nerve comfort tablets, iron formulas, and certain antihistamines, are scientifically documented to slow down your lower digestive transit speed as an unintended side effect. This does not mean you should stop your prescriptions. It means you must have an honest conversation with your care network. Ask your provider directly, could any of my current daily pills be contributing to my digestive slowdown? And if so, are there alternative options that carry less impact on my lower tract? Many practitioners simply will not bring this up unless you raise the question first. Rule number 4. Be exceptionally careful with stimulant laxatives. This is an issue where I see substantial harm caused in mature patients because the marketing can be highly misleading. Chemically forcing your bowel to contract using harsh stimulant options is useful for brief emergencies, but when they become a daily crutch, something troubling happens. Your intestinal muscles begin to depend entirely on that outside chemical trigger to initiate movement. Over time, without the pill, the muscle simply refuses to contract on its own, resulting in laxative dependency. If you have been utilizing these options daily for more than 2 weeks, speak with your provider to design a gentle plan to step away and rebuild your organic motility. Rule number 5. Establish an unshakable bathroom routine. Your digestive tract follows a strict internal circadian rhythm, just like your sleep cycle. Your natural clearance signals are strongest within the first 30 minutes after waking and immediately following breakfast. Use that exact window every single day. Visit the bathroom at the same time every morning, whether you feel a strong initial urge or not. Sit down, relax your shoulders, and give your body 10 quiet minutes. Within 2 to 3 weeks of consistency, your system will naturally synchronize with this schedule and initiate movement automatically. Finally, your physical posture matters far more than you think. The human framework was never anatomically designed to eliminate waste from a flat, seated position with the thighs at a rigid 90-degree angle to the floor. Sitting flat keeps a strong pelvic muscle, the puba rectalis, wrapped tightly around the rectum like a closed sling, creating a natural mechanical kink. Placing a simple step stool beneath your feet when you sit on the toilet raises your knees above your hip level and transitions your body into a natural squatting angle. This simple shift completely relaxes the muscle sling, straightens the rectal path, and dramatically eases the mechanics of elimination. It sounds almost too basic to make a structural difference, but for mature adults with relaxed pelvic muscles, this single change provides an immediate upgrade in comfort. Your digestive health is deeply intertwined with your daily energy levels, your immune resilience, and your total quality of life. Yet it remains one of the most neglected aspects of mature wellness because people feel embarrassed to discuss it. We have broken through that barrier today with real science. Stay consistent with your daily water, move your body gently after meals, use a footstool to optimize your posture, and let your biology show you how beautifully it can respond when given the right conditions. Thank you so much for exploring these strategies with me today. Take outstanding care of your health, look after one another, and I look forward to sharing more insights with you right here in our next episode.